Ingrid Leary.
Madam Speaker, we know things are pretty dire when the emergency departments at hospitals become the place of last resort for people with mental illness. That is exactly what is happening thanks to this government and a lousy budget that put virtually no new money into mental health. We know that mental health is getting worse under this government, and when we look at the context, we can see cuts to places like Seeger House in Auckland, which is needed for chronically suicidal people. We have the Mental Health and Wellbeing Commission, which last week reported that fewer people are accessing specialist services and addiction services, despite the fact that the government's own reporting shows a significant increase in the wastewater testing, with drugs showing. So how is it that they are not accessing it? Well, the government's own report from the Mental Health and Wellbeing Commission says it is to do with the workforce gaps. The budget would have been the perfect opportunity to address that, including the 1,594 full-time equivalents that the NCAT, which is the National Committee of Addiction Treatment, has identified as missing from the NGO frontline. But no, they did not. Instead, they threw a paltry bit of money to help the transition at emergency departments for the withdrawal of police, and that was far too little, far too late. We have already seen traumatised staff members, traumatised patients, traumatised clinicians, traumatised people under the Mental Health Act because there has not been a strategy in place. There is no comprehensive strategy. The mental health workers do not have restraint powers and do not want restraint powers, and the work has simply not been done to equip them, and that is something that should have been thought of long ago. The money that went into that could have gone into the front line, into addiction services. Instead, it's a bit of a patch-up job. Meanwhile, there have been cuts to the funded sector. There are some 56,000 people every year that access those frontline NGO services, and yet we have had 5,000 people in the sector who now will have their pay equity claims cut. They are experiencing burnout. Many of them have gone to Australia. There is no pathway for them to get that pay equity sorted out. They are in a context of rangatamariki contracts that have been cut, and now, just last week, many reputable addiction services throughout the Motu have received a pro forma letter from this government saying that they've got contracts coming up, rolling over in June 30 or September 30, didn't even distinguish which timeline, and said you might get a letter saying that your services are being extended, but no specificity of which contracts, no specificity of whether they will be able to keep their staff on, and just a pro forma letter. Absolutely lousy. Probably a result of the fact that this government has gutted the public service and didn't have the staff to write the letters properly. They would not run a business like this. How do they expect the NGO sector, who are dealing with frontline mental health crisis and mental trauma, to be doing the work when they're putting them in this pressure cooker? No pay equity, burnout, uncertainty over contracts, no workforce plan, and a little bit of money going towards the transitioning away from the police. Absolutely hopeless budget. And then they talk about baselines. Even on TVNZ on Saturday night, the Minister for Mental Health referred to the psychiatry baseline of 33 psychiatrists. Well, where on earth did that figure come from? Because the Royal Australian New Zealand Psychiatrists Group have the information that the baseline is actually 44. They did that work in conjunction with the government. It is a shared document with Health New Zealand, but the government insists on making those baselines look better so that they can game them. We've seen that with the psychology roles as well. They gamed them from 90 down to 50 to make them easier to achieve. Instead of putting money into this budget, the government instead tries to fiddle with the goalposts, fiddle with the narrative, and say everything's going okay. Well, I tell you it's not. And where we see the evidence of that is in the emergency departments. That is where we are seeing homeless people turn up. That is where we are seeing people with mental trauma turn up. That is where we are seeing people waiting for hours and hours, unable to be seen because there is not the frontline workforce to support them. So when it comes to the health budget, Madam Speaker, mental health, which should have been a deserving recipient, got absolutely nothing. Shameful day. Mental health is getting worse under this government.